Good morning. Open the meeting of the Fiscal Committee for February 20th, 2026. And we'll start with the acceptance of minutes.
So moved.
Motion by Senator Gray, second by Senator Lang to accept the minutes. Any omissions or corrections? Seeing none, all in favor say aye.
Aye.
Opposed, no. They are accepted. And we have no old business. We have a consent calendar for tabs 3 through 8. So far, I have one item removed from the consent calendar under tab 6. It's 26045. Are there any other items to be removed from the consent calendar? Seeing none, I'll entertain a motion.
Move the consent calendar as amended.
All right, Senator Gray moves to accept the rest of the consent calendar, and Senator Rosenthal seconds. Any further discussion? Seeing none, you're ready for the question. All in favor, say aye.
Aye.
Opposed, no. That motion is adopted. So we'll turn to tab 6, 26045. And that is the Department of Health and Human Services. And Director Nathan White is here to explain this.
Good afternoon, Nathan White, Chief Financial Officer with the Department of Health and Human Services. And Chairman Weiler, you'd just like to have an overview of the item?
Yes, please.
Of course. So what's before you are two actions. And the first action is the acceptance of the Rural Health Transformation Grant, year 1. And the total amount is $204 million. And those dollars would be received by the Department of Health and Human Services, and then those dollars would be passed through to the Go North office, and the vast majority of the funds would be passed through. The only funds that would remain within the HHS budget would primarily be the allocated costs and the indirect audit costs that are required. We previously did submit an item on behalf of the Go North office before the office was formally established. And the second action there, that makes a correction to the original budget. The original plan was for the funds to go directly to the Go North office. However, due to some complications at the federal level, to avoid any delays, any administrative delays, the HHS is now acting as the pass-through and receiving those dollars. And that's why you're seeing both the Department of Health and Human Services establishing an AU to receive those dollars, and then the amendment to the Go North accounting unit as well, so that we're truing up the amount that we actually received, which as a state was a total of $204 million for year 1.
So is this a multi-year thing, or is it all for year 1?
This request here, this is just for the first grant year. There will be, it's a 5-year award. So this is $204 million. It's $4 million more than what we applied for. We actually received more money than all the New England surrounding states. We would expect to see potentially $200 million in subsequent years. I mean, we don't yet know. This grant's a little bit different from other grants that the department has historically received, in the sense that there are reporting requirements that the state will be subject to. And what the federal government will be doing is they'll be monitoring the actual spend. They'll be monitoring the performance, and based on what they're seeing, they may adjust future amounts for states. So if we do well and we spend the money in a timely fashion and the program is successful, then we actually could be rewarded for that in the future.
So this kind of means we have to have a building, we have to pay rent, we have to have a lot of staff. And is there time for all this? Is it ready to go right away, or has staff been hired?
So the department began this work, and the commissioner is going to come up here and give an overview.
It didn't take long after you got up from the chair.
That was loud.
Pretty
Lori
smart. He knew you
Weaver.
were coming.
HHS Commissioner, we also have Donnelly Lozo, who is the director of Go North. So when we're talking about staffing, and feel free,
There's a chair over there with a microphone.
yeah, there's a chair over there with a microphone if you have questions. So Go North is going to be administering all of the grants, all of the money, the oversight that Nathan is referencing is all done by Go North, and Donnelly is the director of that, and then there's staffing within that. So they can't really hire staff until this item passes to accept the money, and so we have it in the account. But there is a plan that Donnelly could speak to if she wanted to about staffing. And so a lot of this money will go into procurement, and we will have competitive procurements to release the money for the change that's going to happen wherever it is in the state.
Some of these grants in the past have gone to overtime for state police and sheriffs in that area. Is there still some of that, or are we replacing them with new staff?
So in order to receive the 204 million that we did, we have to submit an application to CMS that basically said, hey, this is what New Hampshire wants to do. And that was with the input of New Hampshire. That wasn't the department deciding that. That was all of our partner providers and constituents weighing in. And then CMS approves that plan. So we spend according to what we were approved to spend.
So again,
Senator
you.
Lang for a question.
thank you, Commissioner, for taking my question. So again, but we're talking about increasing medical service availability in the North Country, and this program and this money is designed to help the North Country help get physicians, nurses, those kinds of things to provide easier access to quality healthcare in the North.
Correct. So those were a lot of the things that we heard about transportation, about in-home medical equipment. All of those big pieces we put into proposals that vendors can bid on to be able to say, I want to be able to provide this service. And they would do that with Go North.
Thank you.
Okay, I guess we get questions from everybody. I'll take Senator Rosenwald, then Senator Birdsell, then Senator Waters.
Thank
Senator-
you, Mr. Chairman. Thank you for taking my question. So you're asking for 121 million for grants for public assistance and relief. I don't think we've seen sketched out exactly what the programmatic elements look like for this first year of Go North. Is that something you could make available to us so that we know how much is to increase workforce, how much is for home equipment, or all the elements of the spending plan that you got the 204 million?
Sure. I can't do that right now, but I can do that. What is on our website right now is our plan. So there's the feedback from the community, how we formed that into the application and the plan. What's not in there is the dollar amounts associated, because there's some competitive procurements, and we, being a smaller state, weren't posting those at this time. But as those roll out, we'll be able to do that. Go North is going to have its own website, which will list all of the procurements that are coming up. And as well as other information that you're asking for. I just can't do that right at this time.
Got it. Thank you.
Senator Birdsell for a question.
Thank you, Mr. Chair. Thank you for taking my question. I know that there's a hiring freeze in the state. Is this Go North hiring, is that going to be included in that, or is this a separate entity?
So Go North was established with an executive order by the governor's office, so it does allow hiring for those positions under the governor's office under Donnelly.
Senator Waters for a question.
Thank you, Mr. Chairman. Thank you. So, in terms of the future grant awards, I see on page 2 that period 2 is expected to receive September 2026. So, is that potentially the next 200 million, or how does that get phased?
Yeah, so Senator Waters is referring to the chart there that he identified on page 2 of 5. What you'll see there is there's 5 bars, and the first bar you'll see is spending for budget period 1,
Yep.
and this 204 million is part of that budget period 1. So then, with the next federal fiscal year, and for budget period 1, we only have about 18 months to spend it. And with subsequent years, we'll have a full 24 months to spend those dollars. But The plan that has been submitted and approved, it accounts for that, so that spending isn't necessarily linear, so there's a ramp-up period of time to make sure that the state is successful.
Further question?
Thank you. So what I'm trying to kind of understand is over the period of the Go North program, how many, at what moments will there be additional funding and how much? And then related to that question is it basically, will those grants sustain kind of what you have or they allow expansions?
Sure. So I'll answer the first question, then I'll hand over the sustainability question to the commissioner. So we would expect to receive those grant awards sometime before the federal fiscal year. So this accept and expand is just for the first one. We would expect that the governor's office, Go North, would and HHS, we would be coming back in the future, probably in the late summer, potentially August, to accept the subsequent award, or potentially even September timeframe. That's probably when we would know it. And again, because this grant's a little bit more dynamic than most that we work with, where the feds are actively looking at performance and spending, we won't necessarily know if it's going to be 204 or 20 or 200 or 198 or whatever it might be until we near that point. I think that's just one of the unknowns. Sometimes we get these 5-year grants with a pretty strong certainty of what that figure would look like. But in this case, it's just a little different. And that's why timeliness is so important in accepting these funds and getting the contracts going. I'll hand the sustainability question over to the commissioner.
Thank you. I want to make sure I understand the question. Would you be able to repeat it?
Yes, so if let's say we get the around $200 million each phase of this, is that to sustain the basic plan that you have in place, or would you be able to expand or shift to other services over that period?
So we would award contracts based on deliverables that were approved, right? And then I think we would be evaluated on how well we deliver or don't, and Go North would do that with CMS. And if there needed to be course correcting and shifting, I think that would be the negotiation that we would do with CMS to be able to say. But in terms of sustainability in general, I would say that the money is to create the transformative change, and then whatever change you make has to then be sustainable. So we make these investments, but the investment is to make it happen, not for it to keep going in the future. And so for an example, we are looking at, having certified behavioral health clinics, right? So that the goal there is to be able to have services that meet all of the needs of whoever the recipient is. So that's mental health and primary care health. It allows the community mental health centers to have alternative payment models, which ultimately pay them at a higher rate than what they're getting now. So the idea would be that would offset some of the uncompensated care, and that they would be able to sort of work with that. And that's the pickle that we've been in with, the high level of uncompensated care. So that's the idea of sustainability, is that we're making changes in that infrastructure, in that model, and that financial model to be able to sustain in the future. So that's one example, but there's a bunch of different other ways too.
How many new staff?
In Go North? About 20. I heard a voice from the back say about 20.
20? Okay, any further questions from committee?
Move to approve, Mr. Chair.
Okay. So motion from Senator Lang to approve, second by Senator Birdsell. Further discussion? Seeing none. All in favor, say aye.
Aye.
Any opposed? That motion is adopted. Thank you very much.
Thank you.
So we'll look forward either to seeing it on your website, or if you don't have the website up, give us a report next quarter. Thank you. All right, so we're moving now to the regular calendar, starting on tab 9. Item 26041. This is Department of Health and Human Services again. Any questions from committee members? We'll entertain a motion to adopt.
Move to approve.
Okay, a motion by Senator Gray, second by Senator Birdsell to adopt the item. Any further discussion? Seeing none, all in favor say aye.
Aye.
Opposed, no. That item is adopted. Moving on to tab 10. Item 26027, Department of Transportation. Move the item. Representative Birdsell moves the item and is seconded by Senator Birdsell. Is there any further discussion? Seeing none, all in favor say aye.
Aye.
Opposed, no. That item is adopted. Moving on to tab 11. Two items, and these have been adjusted.
Move to approve item 28 and 29.
All right, that's, and Senator Lang moves to approve both items, 028 and 029. Any questions on these items? I guess everybody's gotten the revised and reduced. What's that? I think that was seconded by Senator Birdsell again. Oh, no, Senator Rosenwald. All right. So FIS 26028 and FIS 26029 are both in this motion for approval. Further discussion? Seeing none, all in favor of this two items being approved, say aye.
Aye.
Opposed, no. Those items are adopted. Moving on to tab 12. Item number 26034, Department of Corrections has been withdrawn.
I would like to comment, Mr. Chair.
Certainly.
We are looking very closely at these things, and if you come in and ask for new money, it's gonna get looked at very, very closely, okay? And if you come in and ask for new money on overtime, and you haven't told us how you are spending the money that would have been spent on straight time to get to that overtime, then you're going to get a question from us at least. So again, scrutiny, the budget is tight, the budget is very, very tight. So especially if it's new money, we're gonna be looking hard at it.
Yes, I'm glad you make that point because any new money is likely to have to come out of the rainy day fund. And there's certain limits to how much we can take out of that, so.
Mr. Chair, question?
Sure.
So for you, so again, on this item, I know we asked a question of the agency, and I'm wondering whether we'll still get a response considering it was drawn, and the question was, Senator Gray's point, if you have so much overtime because you don't have enough staff, there should be some money left over in your full-time line, and we wanted to know what the budget lines, what those balances look like, and we haven't heard from that. So I'm just wondering whether we are gonna get an answer to that, or if we're gonna wait till this comes back.
Senator Gray.
Chair, let me answer that. They need to come in and true up their accounts no matter what, okay? So they overspent the overtime line, so they need to come back and at least adjust that some way, whether that's new money or transferring money out, and that's all gonna come back through us, as long as it goes, it's within the limits. And
And we will also, Mr. Chair, we'll also reach out to Department of Corrections. We did pose questions relative to the, the vacancy rate, the available funds, and the other class lines, and we'll make sure the committee gets those answers. Even prior, if we get it prior to the next item, we'll provide that.
Thank you, Mr. Kane. Further discussion on that item that has been removed. So there's no vote called for. Moving on to informational items. Anything that the committee wishes to have questions answered on any informational items? Nobody has any questions, all right? I guess we are ready then to move on to the audits. We have a few of those before us.
it's just that you're so efficient. There is things I want,
Some of those we work on outside of this.
Okay. Good afternoon, Mr. Chairman and committee members. For the record, I'm Christine Young, the Director of Audits for the LBA. We're here to present the annual reports for the college savings plans. As you know, our office retains the services of PricewaterhouseCoopers to perform these audits. And with us from PwC is Sean Kay, the partner, and Monica Mezzapelli, our state treasurer and the trustee of the plans, will also be available for questions or comments. And with that, I'll turn it over to Sean for the presentation.
Thank you. Thank you, Christine. Appreciate the chance to be here to present to you. I'll keep my remarks fairly summary level.
This is the
Yes,
first
those
one.
are the materials there. Thank you. And so if you're looking to follow along, page 5 is where I'll focus my commentary. So in scope for the audits, while we're moving through that, are the unique college investing plan and the Fidelity Advisor 529 plan. Those are the structures for the state of New Hampshire with 70 plus underlying structures. The year end for those entities is September 30th. In 2025, we presented to the treasurer and her team our plan. We were able to execute on that plan. And then in December, on December 12th, 2025, I issued a clean opinion for each of the structures, given the very good outcomes that we encountered during the course of our audit examination. In our examination, we tested 100% of the assets. We validated the pricing. We validated the existence of those assets. We were also able to undertake a number of focused judgments related to the fees the state of New Hampshire collects. Again, the results for all of those examinations, for all those inspection items were very clean. We had no material weaknesses. There were no audit adjustments, nor were there any items that were unadjusted and need of reporting to this group. So obviously the control environment that we encountered at Fidelity, who is the sponsor for those structures, was also just clean as in historical periods as well. The rest of our materials are fairly routine, and so given that they're not extraordinary, I'll take them as read if that's okay with the committee. But I'm happy to answer any questions the committee may have on our audits of those two structures.
Questions from committee members? Okay. And, the treasurer, Mezzapelli, and I are familiar with a lot of these things because we look at them every quarter from Fidelity.
Good afternoon, Mr. Chair, members of the committee. For the record, State Treasurer Monica Mezzapelli. I just want to take the opportunity to thank Mr. Sean Kay and his staff, and also Director Young for the work that they do on these audits. I mean, these are excellent, clean audits. Always happy to see these results, and also happy to see that our program manager continues to do an excellent job with not only with the operations and also managing the plan. So I just wanted to take the moment to thank him for all their work. It was always a pleasure to work with them. It is an easy part of my job, so I'm always very thankful for that. And regarding the plans, members of the advisory committee know the plans are doing really well. We continue to grow. The plans are about right now over $32 billion in assets under management. As you all know, we get a portion of that. It's revenue that we use for scholarship programs. We did really well. We spent most of the money we spent all of the money in scholarship programs last year. The plan is to continue to do that and provide scholarships for low-income students. So again, always happy to talk about these programs, the highlight of all of our jobs, I believe. So I'll be happy to answer any questions.
How much revenue are we getting this year from the program?
We anticipate about $20 million in revenue.
20 million.
And again, there's a portion that goes to the general fund, but the rest will come to the trust, and that the plan is it will be used for scholarship programs.
Very good. Committee members have any questions? go to quarterly meetings, and I'm impressed with how thorough our treasurer is and keeps a good handle on this, and that's why it's as successful as it is. Thank you very much.
Thank you.
And anything further? I believe, Mr. Kane, we've already had a motion, or do we need to?
These have already been released.
We've already been, made the motion to place them on file and release in the usual manner. All right. Any further questions on any of these audits? Seeing none. We'll go to other business. Thank you very much. Appreciate all the good work, and I'm glad everything's working out. All right, Mr. Kane. What other business would you like us to work on?
Date of the next meeting. So you could do March 20th if it works for all your schedules, or any other day.
So March 20. I don't have anything that far ahead. Spring equinox, okay. Anybody have any restrictions as to when we should start? Is there any preferred time?
We
Well-
were doing 11. I don't know if that's where we want to go.
Well, at this point, we can make adjustments to that because
Mr. Chairman, I would just bring up that I wasn't at the Health and Human Services Oversight Committee this morning.
They meet that same Friday?
It's my understanding they mentioned the Friday after, so we may be clear. Is that true, those that were in attendance?
27th is when they're planning a meeting.
Good, so that won't interfere with it, thank you.
Okay.
Mr. Giles,
I know
I'm not sure
some of you
which
go to that.
members are on JALCAR, but we meet at 9 that morning,
GLCAR meets at 9 that
9.
same day,
the same day.
so how long do you usually go? It's fairly lengthy.
If you did 11, it wouldn't interfere, I don't believe.
That's one of the reasons we went to 11.
Would you like to have that meeting start at 11? Everybody, any objections over here? Friday, the 20th of March, 11 o'clock, probably in this same room. I'm amazed at the items we had that were non-controversial.
I think everybody's just trying to get home before the snow.
We've got another meeting scheduled for House Finance, so we can start early, but I wish, see how many other people are available. All right, I think if we look out in the hall, we may be able to start an early meeting. We might have a lot of the members here now.
Depends on when you were announced for us.
Announced for 2:30.
Sorry about that.
I thought we'd go longer, but this is kind of a record day. So, unbelievable. Thank you all for your attendance. Motion to adjourn in a second. We are adjourned. All in favor? We are adjourned. All right.